right, good morning. My name is Margaret Wicinski. I am an associate professor and the assistant program director on the St. Augustine, Florida campus for the DPT program. The first poster I'm going to talk about is When Imaging Clouds a Diagnosis, a Case Report. This case report was compiled for this presentation due to the nature of the patient's symptoms, imaging findings, importance of subjective history taking, and direct access to physical therapy. Within this case, a 40-year-old female complained of left lumbar, sacroiliac, left anterior and lateral thigh pain with numbness with no known mechanism of injury. This patient was evaluated by her physician and had an ultrasound that revealed an ovarian cyst. Upon seeking outpatient physical therapy using direct access, the physical therapist and the patient completed a thorough subjective history. During the subjective history is when the patient did recall her changing her fitness routine with adding 4 new yoga poses. Once this piece of information was recalled, we were able to correlate her symptoms to this new onset of pain. When evaluating this patient in an outpatient setting, basic physical therapy measures were complete. However, using the literature and clusters of testing, the physical therapists examined the patient and found that the clusters of Levangie and the clusters of Linsett were found to be positive. This further provided data to the physical therapy diagnosis of sacroiliac dysfunction versus the medical diagnosis of an ovarian cyst. Prime takeaways from this case encourage physical therapists to take subjective histories and critically think and differentially diagnose. The clinical reasoning process to rule in or rule out lines of questioning during the subjective history takes practice and is an art. In addition, utilizing various question types will perhaps jog a patient's memory to think about other activities that could potentially contribute to a mechanism of injuries. Some patients are labeled as poor historians by healthcare providers. However, the questions that were asked might not have been the questions that needed to be answered. Imaging is a very useful diagnostic tool that can be used to confirm diagnoses for patients. However, at times, imaging can cloud a diagnosis and delay referral to physical therapy due to medical findings on imaging. This patient did follow up with her physician for care for the ovarian cyst and progressed well with a physical therapy plan of care with resolution of symptoms in her SI joint and her nerve pain. And I can switch to my next presentation.